Hey everyone, and welcome back to our channel, Breaking Down Nursing, where we break down complex nursing topics into easy to understand lessons. Today we're going to dive into the world of arterial blood gases, or better known as ABGs. These are crucial skills for any nursing student or healthcare professional, and by the end of this video, you'll be able to interpret ABGs just like a pro. ABGs are a set of blood tests that give us vital information about the patient's oxygenation, ventilation, and acid-base balance. These values help us to assess how well the lungs and kidneys are working together to help maintain the body's pH within a normal range. ABGs are made up of four main components: our pH, our PaCO2, our bicarb, and our PaO2. Let's dive into each of these further. First and foremost, our pH. Our pH tells us if our blood is too acidic or too alkalytic. We all remember the graph back from chemistry back in the day on our pH scale. Our body likes to stay in the 7.35 to 7.45 range, which is normal pH for human beings' blood. Of course, the more we go to the left of the scale, the more acidic we become. The more we go to the right of the scale, the more alkalytic we become. So if we're below 7.35, that's correct. That creates acidosis. And if we're above 7.45, you guessed it, alkalosis. What really drives our pH value? How do we know if we're acidotic or alkalotic? Well, that really comes down to our PaCO2 and our bicarb. Our PaCO2 is the partial pressure of carbon dioxide, and that's reflected in our respiratory component. So how fast or how little we breathe really does determine on how much acid we have in our bloodstream. The more the CO2, the more acidotic. Now, our normal range is 35 to 45 millimeters per mercury. And the easy way to remember that is our normal range for pH is 7.35 to 7.45. So just take off the 7. It's one less number you have to remember down the line. Now, looking over to our bicarb, or HC03, this is our metabolic component, and that's really regulated by our kidneys. So that lets us know if it's metabolic in origin. Our normal value is 22 to 26 milliequivalents per liter. The higher the bicarb, the higher the likelihood of alkalosis is happening. So that's our base. More base, more alkalosis. Our PaO2 is a very important part of our ABG. However, this really only states our oxygenation status, not our ventilatory status or our pH. So our normal PaO2 is typically 80 to 100 millimeters of mercury. If we have less than 80 millimeters of mercury, this really leads to hypoxia. So you see this in patients that need more oxygen or potentially on a ventilator. Remember, our hemoglobin likes oxygen. And so if we have a low PaO2, our treatment, of course, is oxygen. All right, so let's break down the steps during ABGs. So step 1, we're going to check the pH. We're going to determine if the patient is in acidosis or alkalosis. So if our pH is less than 7.35, we're going to be acidotic. And if our pH is greater than 7.45, we're going to be alkalotic because we're outside the normal range. Move into step 2. So we're going to look at our PaCO2 and see if it's a respiratory issue. If the pH and the PaCO2 are moving in opposite directions, the problem is likely respiratory. Because the higher the PaCO2 goes, the more acidotic, or the more acid is going to build up into our system, creating our pH to go down. Step 3, we're going to evaluate the bicarb, or HC03. If our pH and HC03 are moving in the same direction, this typically leads to a metabolic issue. The higher the pH, the more alkalotic. And remember, our bicarb is a base. The higher our base is, the more alkalotic it's going to make our pH. Step 4. Check for compensation. It's very important to know, is our body trying to correct this imbalance? If you see the PaCO2 or the bicarb changing in the opposite direction of the disturbance, then compensation's at work. If our pH is back to normal, then we're fully compensated. If our pH is not back to normal, then we're partially compensated. And if our PaCO2 or bicarb are not changing at all, then we're uncompensated. And finally, step 5, we assess our PaO2 to evaluate our oxygenation status. Because remember, our PaO2 does not affect our pH. It only tells us our oxygenation status and whether or not our patient needs higher levels of oxygen than what they're currently on. Okay, so that's a lot of words. So let's put it together. For example, we have a patient, we got an ABG back, and our pH is 7.30. Our PaCO2 is 50 millimeters of mercury, and our bicarb is 24 MEQs per liter. So let's figure out what our ABG reads. So again, we're going to go step by step. So, step 1, check the pH. We know our normal pH is 7.35 to 7.45. And our pH for this example is 7.3. So we know that this is low, meaning acidosis. Now look at our PaCO2. We know our normal PaCO2 is 35 to 45, and our PaCO2 in our example is 50, so that's higher. So we know the more CO2 a patient has, the more acidotic they're going to become. So we're going to do an up arrow, labeling acidosis. Our bicarb is 24. Our normal bicarb number is 22 to 26. So this would lead us to a normal bicarb level. So what does this reading mean? Since our pH and our PaCO2 are going in opposite directions, and we have an acidotic state, this would lead us to believe that our CO2 is creating the primary disturbance. So our PaCO2 is creating a respiratory acidosis. And we know that since the bicarb is not compensating, we have an uncompensated respiratory acidosis. Okay, so it's your turn. Hit the pause button and try to see if you can figure out this ABG by yourself before we go through it. I'll be waiting here with your answer. All right, so let's see how you did. So for pH is 7.48, if you guys guessed alkalosis, you're absolutely correct. Our pH is elevated, making us alkalotic. Our PaCO2, if you correctly guessed acidosis and elevated, you're absolutely correct. Our normal for PaCO2 is 35 to 45, and with the PaCO2 in this example of 48, we're too high, making us acidotic. Looking at bicarb, if you correctly guessed alkalosis, perfection. 22 to 26 is normal, so 32 is absolutely out of range and too high. Looking at this, we know our pH and our bicarb are going in the same direction. Our pH is alkalosis, meaning that we have a metabolic alkalosis happening. So our next step is trying to figure out, are we compensated or not? And this would show partial compensation. Our pH is not back to normal. However, our PaCO2 is trying to correct the situation that's caused, or the primary disturbance that's caused by our bicarb. So with our PaCO2, we're retaining CO2, trying to create a more acidotic environment to balance that alkalosis by the bicarb. So our final answer, partially compensated metabolic alkalosis. Understanding ABGs might seem tricky at first, but with a systematic approach, it becomes much easier. Remember to practice as much as possible. It's all about recognizing patterns and applying what you've learned. ABGs are just one tool in your toolkit, so always consider the full clinical picture when trying to consider your patient. Thanks for watching. If you found this video helpful, give it a thumbs up and subscribe for more nursing content. And don't forget to hit the bell icon so you never miss an update. Love to see you at the next video, and if there's anything you'd like to see in the future, please drop in the chat below. Have a good one.